Good morning, everybody. Welcome to the webinar, Arogya World's webinar series on Emerge Stronger from COVID. My name is Nalini Saligram, and I'm the founder and CEO of Arogya World. We're a global health nonprofit working on diabetes prevention through healthy living. During COVID times, we started this webinar series to explore topics of interest to us. We have explored so far the impact of COVID on health topics, on women's health, on obesity, diabetes, and the links with mental health. We've also had a chef tell us about practical tips to eat a healthy meal. And today we're exploring a social issue. We are looking at the impact of COVID on women and their families, and exploring the tough choices sometimes women have to make between work and life and family life. I wanted to thank Gloria Barone, one of our board members, who has curated this panel discussion for us. And moderating the panel discussion today is Jayne O-Donnell. Jayne is USA Today's health policy reporter. She's also co-founder of the Urban Health Media Project, which trains high school students to report on health and social issues. An author, TV contributor, and freelance writer, Jayne has appeared on Good Morning America, CBS This Morning, CNN, MSNBC, NPR, and C-Span, and has been published in Women's Day, Good Housekeeping and Parents. She brings the additional perspective of being a working mother herself. Personally, I've been really looking forward to this discussion where the perspectives of women, working women, business leaders, mothers, grandmothers, and policy experts is all going to come to light. So Jayne, over to you.
Thank you so much. And I was so excited to do this, even though I have, quote unquote, somewhat launched my daughter. She is at Syracuse University studying public health and public policy. As I discussed with Gloria, this is an issue near and dear to my heart because nothing to me seems like it could be possibly more stressful than, in our own little worlds. Being in Washington, D.C. at 9/11, very close to the Pentagon when it was bombed, and covering airlines and having a husband covering terrorism and a toddler at home seemed like it couldn't be more stress. And then different levels of stress were added on to that with this Washington, D.C. sniper and anthrax. But I had a babysitter and she was still coming to the house. Me very lucky, and it was very different. So I think this would be just a whole new ball game. I was so excited to get to meet panelist Lisa McCarthy. She's the president, not only because I think her job is so cool, she's the president of Home Fragrance at Newell Brands, which includes Yankee Candle. We are candle people in my home. She began a career at Yankee Candle and has had increasing responsibility over the years. I have not had increasing responsibilities. I've had more responsibilities because the media shrinks, but I haven't even been promoted, and it's gotten way more stressful. And she, most importantly for our purposes today, she has 4 young school-aged children. How does she do it? And she's going to bring the perspective of how to juggle this kind of a successful career like that while meeting the demands at home. Tammy Boyd, someone else I'm so glad to make connections with. I'm very familiar, being based in Washington, D.C. as well, with the Black Women's Health Imperative, where Tammy's the Chief Policy Officer and Counsel for Government Affairs. And I'm excited that we're going to be able to get at some of the solutions to these issues, because these are systemic, and like everything with coronavirus, everything is brought into stark focus. These were problems that we all struggled with before: the healthcare system, the lack of childcare, work-life balance. She used to be the government affairs advisor to the National Medical Association and worked at DaVita as a federal lobbyist and federal affairs manager for Johnson & Johnson. Her organization, which I know well, is dedicated to health and wellness for women of color. Gloria, I've known for many, many years. She was with Cigna Foundation for a long time, and Cigna, the insurance company. She's now an educator and author, and I'm writing the foreword to her book on young people and loneliness, which is one of my obsessions. You think they have a lot of friends, they may not feel like they do. So that's a whole nother thing I'd be stressing about if I had a child at home right now. I was so happy my daughter could go back to college and just be in her apartment, even if they go virtual. So let's kick it off. I hope that folks will add questions and mention, as you have so far, what where you're from, because that does make it even more fun, especially that somebody's from Zambia. And we do have my longtime colleague, Laura Unger, the Midwest correspondent for Kaiser Health News, standing by. And I have talked to a few doctors who I knew didn't have time to be on today, but I've gotten some advice from them because I really don't know. I think I'd be so anxious to send my child, as much as I love her, back to school that I'm afraid that I might make the wrong decision. So let's start with school reopening, just that issue right there. I know that that the foundation has looked at mental health. I'm kind of obsessed with that, but reopening, it adds a whole nother level of stress and anxiety. I just want to quickly say that I did ask Dr. Kavita Patel. She was a Obama administration White House official who's a primary care doctor in DC, because when I've talked to her, in recent months, she has been home with little ones and a husband working at home, and she was working at home, no doubt, doing telemedicine visits. And she said she's on the board at her school, her children's school. They're 4 and 6. She said that she told the school that the positivity rate, along with the slope of the increase, is what you should be looking at. For example, going from 1.2 to 2%, in the area that is for COVID, is what's concerning. So she isn't as concerned like in the Northeast, where I know Lisa and I are right now. There's so much focus on the 10%. But even her threshold's a lot lower personally for making that decision of which way to go, whether to send her children or not to send them. She'd be less than 5%, and again, if it's increasing closely. But Lisa, let's start with you. What's the plan in your area? I know you're in a slightly different situation, but what's the plan in your area, and how are you thinking about it? Because nobody has to either go back to work. I mean, well, of course, many of us have to go back to work, but a lot of offices aren't requiring us to go or our kids to go to school. So.
Yeah, you picked a good one, Jane. So this is the hot topic right now. When we were prepping so first of all, I want to give a big shout out to everybody on the call. I see a lot of familiar faces, both from work, some from college, some from my old dance experience when I was a young child. So it's really awesome to see everybody on the call. So thanks for joining us. This is definitely a loaded question. And I'll just start by saying, I don't think there's any one right choice. And I think this is a very, there's a lot of strong opinions on both sides. And I think that it's important that we make the choice, we evaluate the choice on an individual basis based on what's best for our families. With that said, in our area, Western Massachusetts, there is a combo of things happening, mostly hybrid openings. So if you can picture 2 days a week in school, 3 days a week, remote learning. And in those most scenarios, you can choose a full remote learning as well. The school that my children go to, so I have 4 kids, their ages are 13, 11, 7, and 5. So they are entering kindergarten, 2nd, 6th, and 8th. So in our school, you can choose between full in-person, 5 days a week, or a remote option. And so, when I first heard that, I got to admit, I was ecstatic. I was pretty much like, yes, I cannot wait to send my kids back to school. They're going, I can't wait. And then, you started to read all these things on the internet and to see all these school reopenings across the country and to start listening to your friends and your colleagues debate the merits of either decision. So, the way that I thought about it for my personal situation, I have 2 children that are going into what I would consider to be milestone grades. So the kindergarten and the 6th grade, entrances for me are big years that really in my opinion, benefit the most from being in person. So that weighed heavily on my mind. And then I started thinking about how to evaluate this. So I first started with the cases in our area, which is exactly what Jayne was referring to with your medical colleague. The cases in our area, specifically in Western Mass right now, are very low. Then I went to considering what the school's plan was for reopening. So my first question was social distancing. How can you affect social distancing? Do they have the capacity for smaller class sizes? Will they require masks? For me, I had to have all those things checked off in order to feel like at least those pieces were going to keep my children safe. And then I sort of went back to, so all those things are great, but what's the plan when a COVID exposure happens? And do I feel comfortable with the school's planned response and how they're going to, notify everyone and keep people safe? And then my last evaluation was communication. Communicate, and do I feel comfortable with my school's ability to communicate the reopening plans and to continually evaluate the reopening plans? With all that being said, I landed in the yes bucket. So I am planning on sending my kids back to school. What I found interesting was, and I didn't realize this, but a few weeks ago, I had to take my children to their annual physicals in preparation for school. And I was talking to my pediatrician about this, and I was telling her, hey, I feel a little guilty. Like, I feel guilty now about making the decision to send my children back to school. Like, I feel like, oh my gosh, am I endangering them just for my own personal, convenience, which made me go back and reevaluate steps 1 through 5 that I just talked about again. But what she said, what I found interesting, was that she said that the American Academy of Pediatrics is actually endorsing sending children back to school and strongly encourages it, but has steps that the school should follow and outline parameters. And so I went and looked those up afterwards, and they were strikingly similar to what, as a mother, I think we all have intuitions on what would keep our kids safe, strikingly similar to those intuitions. So I love the fact that, the American Association of Pediatrics was, giving these guidelines. I love that it was something that I could take and then evaluate how my school was doing against that. And it just gave me a little extra comfort that, pediatricians were saying, hey, yes, if all these things are followed, we strongly encourage, sending kids back to school. So that was a long, really long-winded way of saying my kids are going back to school, that we're going to be prepared for a remote option. Obviously everyone was remote in the spring. And so I think step 2 of this is making sure that your remote plan is, hopefully markedly better than what we experienced in the spring when we had little to no preparation. So
you're not a bad mom. You feel guilty.
I feel guilty. Yes, I do. I think I've overcome that now. I'm pretty, solid in my decision. My husband and I have talked a lot about it. We could pick the remote option for sure, but I think for my kids, mental health, social interactions is really important. And again, for those milestone grades, I feel really strongly about, sending them back to school. I understand that is not the same priorities or decision for everyone. And I respect, everybody, where everybody lands on that decision tree. And I think that's one thing that I just want to encourage is, I think as women, being encouraging of where we all land on the spectrum of decisions is really important to me. And I just hope that I can be encouraging to wherever anybody lands in this decision process.
Right, that society is divided enough, and the work at home versus not work at home moms, it can be so fraught. Tammy, so you're in the area where I usually am. I just don't happen to be right now. But Tammy, so DC is remote, isn't it? And I think I just saw the Maryland governor is doing in person. Is that right?
That's correct. DC is remote. And Maryland, as you said, I think, Virginia is sort of a hybrid. And what we're hearing is pretty consistent with what Lisa mentioned, that, parents are just, women are assessing whether it's even safe to go back to school, to send their children back to school. But particularly for, minority women or low-income women, one of the issues even becomes for them, if you send your children back to school and you're hearing about all these different positivity rates, as we've seen for minorities, for African Americans, that they're disproportionately impacted by COVID. So sending their children back to school to then, possibly, test positive and then bring that back to the family is even more exacerbated for African American women. But even the remote option, there are even challenges there, because then you get into access to technology. Will they be able to access the technology to continue to do the remote and virtual? And so that's one of the things for policymakers that we're advocating is, employing policymakers to increase access to technology for lower income families.
And also, Tammy, when people, I was thinking also of the women, we're talking mostly about women, but parents who do need to work, like to leave the home to work. Laura Unger, as I mentioned, who's based in the Midwest in Kentucky, actually, she and I were talking about if we talk about the low income population, like they might not be able to afford childcare anyway. And then this adds a whole nother level that they may not be getting time off from work. They can't miss. And it might hurt their chances to even get advancement. They might be able to work their way out of into the middle class. Any thoughts on that, on what could be done kind of societally, or what is working to improve childcare for people like that?
Yeah, so, there have been several different options. As you know, the CARES Act had funding in there for like frontline workers who needed a place for their children to provide childcare. And so, in the next COVID package, there have been several pieces of legislation that have sort of advocated for increased childcare or funding to sort of help them with that. And so we're, working with several, there have to be at least a dozen bills, and I could go into the specific ones. I can kind of wait till later to kind of go into that, but there's several pieces of legislation out there now that are being considered by Congress to address that very, very issue.
Then of course, sometimes it can be impossible. It's one thing to have money for childcare, but you might need, like Gloria used to be, or you might need somebody like Susan Heil, a longtime friend of mine who's on the call. Her husband was putting tinfoil things on his head and pretending, doing all sorts of acting out for their young nieces and nephews to give other family members a break, just to kind of pitch in where they could remotely. Gloria, what about grandparents and the kind of struggle on protecting themselves, but then also helping out their children?
Yeah, so, when COVID first hit, there wasn't, we didn't really know where this was going, and there was a lot of fear. And so, being in that older, quote unquote, high risk group, I stayed away from the grandchildren for a number of weeks, and I was absolutely miserable. So while I was protecting my physical health, my mental health was really suffering. I was absolutely not okay. So we started, as Lisa has said, you really need to look at your community, so that when you decide what you're doing, it's beyond the school, but it's the community. So in our community, we've been very fortunate. We live outside of Philadelphia in a small town, very low rates of COVID. So after we kind of evaluated our personal situation, I would start to see the grandchildren maybe 1 or 2 hours a morning, outside only, with a mask. So my daughter, who's sort of losing her mind, trying to work home, she has a very stressful job in the social work field, so she could get a break for maybe even an hour, so she could make a phone call. So maybe she could go out to the park across the street and do a little run or anything. And then as time went on, the children were not seeing anyone outside of their home, and a very small group of cousins. They had no play dates, they had no friends. And so I realized that we were in such a little bubble that I could do more, and I sort of reevaluated every few weeks, what's my personal risk? And so I started to do a little bit more. And at one point we had a terrible storm here where my daughter's power was knocked out. And it was like 100 degrees and there was no air conditioning. And so that was sort of a turning point. And I said, come over and stay with us. And some of my friends criticized me for that and said, what are you doing? You know, you're letting all this outside stuff in your house. But again, it's a very personal decision to what Lisa said. And so what I do now in our town, I'll make this quick. We do have the hybrid model. My two little ones one is going into preschool, and my daughter felt it was very important that she not miss preschool because then she'll be behind for kindergarten. So they're doing a half-day program. The other older one is going into 4th grade. It's only 2 mornings a week. So we've already designed a plan where I will pick them up at least a couple of days, have them here, let my daughter try to get, you know, some work done, do a workout, something that relieves her stress. But having said all that, we're really taking it on a week-by-week basis because we really don't know. And I think that's the one thing that COVID has been a very humbling experience for me because I'm kind of a control freak. I like to plan things. I like to know what I'm doing when I'm doing it. And I can't do that anymore. We're taking it week by week. If heaven forbid the cases in town go up or there's an outbreak at school, we'll have to reevaluate the whole plan. But right now we think we can manage and just, you know, on a wing and a prayer, we're hoping that everything will go well.
You're doing your part, so your daughter can stay employed and, you know, maintain a semblance of sanity. And I don't use that term lightly, believe me. So there's, of course, there has been, just to go a little deeper into the childcare issue, there's at least more than 13% of working parents said they became unemployed during the pandemic because they did lack childcare. So, you know, what else, Tammy, this would be a good time to kind of get into a little bit more detail on, you know, how women's jobs might be putting them at risk, but also creating childcare challenges. Oh, you're muted, Tammy.
Yes, sorry. So yes, I mean, as you know, there were already, you know, childcare challenges even before the pandemic. And so, you know, this is definitely exacerbating, or there's more of a burden because of that. And so what we've seen is that, you know, families have tried to, you know, create different options. Some families we're seeing they're doing like a nanny share. Some of them are, like as we mentioned, like create like these pods as well. And then, you know, they're in some states where they did receive funding. They've created like the daycare centers have had, you know, where they can have a certain amount of students there at the school. But in some states, you know, a lot of people aren't even really taking advantage of that. And so some of the different legislation that's happening now, there's like the Coronavirus Child Care and Education Act that's out there. And so that bill, for example, getting to even more so for the child care, now that parents are keeping their students at home, we want to make sure they are safe and they're protected at home. And so a lot of the legislation too is also looking at some of the safety measures for students, for children. And then there's also like providing more grants to child care centers. I mean, a lot, as you know, many of them have actually closed during the pandemic. And so looking for ways to provide additional funding to those child care centers. And then, you know, also even increasing the amount for essential workers, increasing options for them as well. So those are some of the legislative sort of solutions that have been presented for the child care needs.
Could you talk a little bit more? You went really quickly over the pod idea because I know that is what I would be doing. And Lisa, of course, the summer just ended. So like, did you have somebody, like if I had someone coming to my house, if I could get them to continue coming to my house, like back when I did have it, she was single and lived with another person. I mean, it would be a whole nother level of stress, but I think I would be trying to do that and perhaps, you know, offering the possibility to one other family. Is that kind of the concept? See if you can have one child care person that swears that they're doing everything they're supposed to.
Right.
But Tammy, how's it working? And then let's have Lisa tell us whether she's done anything like that.
Yeah, I was just gonna say, I mean, yes, we've had women who've talked about that. I mean, they have had someone, and pay for their expenses and try to make sure, and as much cover as possible, to make sure that they didn't sort of break, that bubble in a sense, or that pod. So yes, we're definitely seeing that scenario.
Yeah, I've heard of very similar scenarios to that. Over the summer, we did something similar. I had my sort of bubble of mostly family members that we were interacting with, but between my siblings and I, we have 10 kids, between us, and so that's quite a number of kids to try to figure out childcare for, and so we essentially had one main childcare person that we would try to share, and it was chaos all the time, but you would try to share it between the children. You try to figure out where, if there was opportunities for the kids to go somewhere. There were some openings like in daycare, optional daycare facilities in our area who had implemented the right social distancing, techniques. And so we had done that, but probably more within a family bubble. But I've heard of a lot of people who have already started that for this school year. And it's a really interesting concept. I think, usually 1 to maybe 2 other families, because as you start thinking through your exposures, those quickly become huge, and depending on people's professions. So one of the consideration sets for us over the summer was ensuring that we had the right communication between that childcare provider and us. Like, my husband is the deputy chief of our local fire department, and so clearly he has exposure on an ongoing basis. They're taking their precautions, they're doing all the things that you would expect them to do, but there is that risk, that inherent risk that they go on calls or to, medical calls where, COVID could be present and they don't know. So I think it's imperative to have that conversation with obviously your childcare provider and the people in your bubble, and imperative for you to understand, what those other exposures are for that pod. With the childcare provider, her brother, who was still in the house with them, worked transport at the local hospital. So it was an equivalent exposure. And so we felt like, we were both in the same boat, right? And so neither of us were taking on incremental risk by putting this partnership together. So, I think I just go back to communication and just research in terms of how to set up the pods to begin with.
Yeah, I hadn't thought about that magnifier effect, especially if you have somebody, what do they, like, you can supposedly socialize with no more than 10 people, but then think about all the people that they might come in contact with. Mm-hmm. I had a colleague who asked a question that relates to, asked a question as she just had a baby. This was before this, that relates directly to what we wanted to talk about kind of career interruption. Tammy, I don't know if you have people working for you. So I'd love to hear like your view from the organization, but let's put the pressure on Lisa because she's the president of a division. I just wonder, what should companies be doing to make it possible for women to continue to kind of move up the ladder? My colleague Shannon Terrell, I think she had her baby about a month ago, and she's the head of podcasting at USA Today, Gannett, and she was just saying, what should managers and companies be doing, on a policy level to support these parents? Like, still do, and I'm in a shrinking industry. I don't know what's going on with home fragrance, but it's really struggling. So like, there's only so much, flexibility you could have perhaps, but what do you think?
Yeah, it's a great question. So I was thinking about this question a lot. We put this on the list. It's a very thought-provoking question. Before I go to the company perspective, let me just give my 2 cents on the career interruption, piece of it. I had recently done a podcast with our communications expert, Beth. She's on the phone. I saw her. She's on this call. And she was great. But one of the questions she asked was about work-life balance and how do you manage that over the course of your career? And, the way that I had always perceived that is, and the answer that I gave was that, there were times in my career where I really needed to lean into work. And I was very clear about leaning into work for a certain amount of time, very communicative with my partner about leaning into work for a certain amount of time. And then there were periods, so that time period could be like a big deal you're working on or a major project. And then there was periods of time, in my personal life where I had to lean more into our home and our family. Good example for us would be when my husband went to the fire academy. He chose in his mid to late 30s to make a career change. And so that period of time was more leaning into my home experience and being more supportive so that he could, pursue his dream of becoming a firefighter. What's so fascinating to me is that now I feel like there's this third concept of leaning into like this blend, right? Like since COVID happened, there is no more, at least from my perspective, for working moms, especially, there is no more separation. Like there has been no separation. And so you sort of have to lean into this idea of, okay, you're blending your whole life. And now more than ever, you're bringing your whole life to the table and everything that you're doing. And so for me, it's subtle changes, but, like when we're working from home, in previous life, pre-COVID, I would have been like, I'm working from home. Here's the 8 hours that I'm in my basement. I'll come up and talk to you when I'm done. And now it's more of, okay, like these kids are going to be around. They're going to be involved. How do I make the most of that? Another thing I was thinking of is like 45-minute meetings versus an hour. Can we push for that so that every 15 minutes out of every hour, I have an opportunity that if they're not in my sight, I can check in on them, right? So like, I just feel like it brings this concept of multitasking and bringing your whole self to both of those worlds in a way that I've never experienced before. And it's not to say that I always was great about not doing work when I go home or not doing personal things when I go to work, but not to this extent at all. And so I think this presents a new challenge for companies to figure out how to meet their employees, where they're at, especially working moms. And so I think, I think a lot of companies are now stepping back and reevaluating their work from home policies, period, right? In terms of what jobs can be remote, what jobs can we offer more flexibility in, right? So even if it's not a 5-day remote, is it a partial remote? And I have to say that pre-COVID, I was the biggest critic of work from home you would meet. I hated it, hated it. If I had a meeting on my calendar with somebody who wasn't in the office, like it was a conference call or God forbid a Teams video, I would basically be like, nope, we'll just do that when you come back to the office, and I would reschedule it.
Why? Just quickly, why?
I think, I think technology has come a long way. So, technology has not always been this good. So, and honestly, the culture of, my business was not one to be technologically savvy or up to date, right? And so the thought of getting everybody to figure out how to use these cameras felt overwhelming, right? Like, and I tried it a couple times and I couldn't make it work and I just gave up, right? Because there's no pressing need to figure it out. Now I have the complete opposite view of this is fantastic. Now, mind you, I still love coming to the office. So I still love coming to the office. But I just feel like this gives us a world of flexibility in terms of attracting new and different talent to our companies who would otherwise have been put off with a static, 5 days in the office. So I think it's really forcing companies to reevaluate what that flexible work arrangement looks like. Are there positions that just don't ever have to come to the office? And then I think right now it's especially important for employers to be signaling flexibility to their employees, right? And to be cognizant of the fact that there is a wide range of experiences going on, and being able to provide for those experiences indefinitely until we get to a point where we can get back to a little more sense of normal. But even then, I just think that the world has changed and employers got to change with it. So that my 2 cents on the whole work-life balance, work from home, blend your career and your work. I think it's been, for me, it's been pretty liberating to be able to be myself at home and work, right? Like I have never had that in my career. And I am so thankful that now I don't have time or, the ability to separate those two things right now. And so I'm actually really thankful for that.
Tammy, do you think this is this kind of encouraging talk to those of us that work that may not be the managers? That do you think it's going to continue? I kind of wonder, but I do think there's going to be some downsizing of offices, and do you think it will benefit people of color?
Well, yes. I mean, we're so many what Lisa said has definitely, reassessing, like, in terms of should we work remote or actually go into the office. I would say Black Women's Health Impaired is a little unique because we had sort of already moved to the remote, but we would do the DC, so we have office in Atlanta and the office in Washington. And so the Atlanta office worked, they were completely remote. And in DC, because we had to go to Capitol Hill or have several meetings, we may do 2 or 3 days in the office, and then the rest at home, working from home. But even with that said, it's definitely I would agree with Lisa, like everything's like all together now in terms of how it was before, even if you did work remote. So this is sort of a different remote aspect. From like our policy team, for example, some of the folks on our policy team have daughters and children. And so definitely, like, I've had to be flexible in terms of, we do a conference call and at 3 p.m. they have their virtual class scheduled for their kids. And, it may be a 6 or 7 year old, and you have to, the parent, the mother would like really have to like, hey, I need to take a break at this time, come back in 15 minutes, 20 minutes. To get my child on, ready for her virtual class. And so it's almost as if the remote actually has moved. You have to be very intentional in terms of the remote is almost moving. Your day starts exactly at 8 or 9 a.m. and it may go even to 7 p.m. And there's no sort of like driving home or getting to the office and talking to your colleagues. And so, but yes, I think for us, the remote has been very effective, almost too effective, because people are seeming to work even more. But I think, yes, people will, they will definitely assess whether the brick and mortar sort of going to the office still is the model. And then B, definitely in the remote virtual atmosphere, being more flexible with other obligations and scenarios of the family.
And we'll get to, when we talk a little bit about mental health, overall wellness is important to keep in mind when it comes to getting away from your computer. And I work on that every single day. It's hard. So Gloria, any other thoughts on that, or just whether the, on that issue, but also just the issue of whether, whether you think that this whole work at home movement will truly be as beneficial to women as we hope, or if it could be a lot more to do with the haves and the have-nots.
Yeah, and I think the short answer is we probably don't know. As everyone was talking, I was hearkening back to the dark ages when I was working like 30 years ago and I had a young child, and there was no work at home. It just did not exist. I worked for a huge company, a global company, but there was no work at home. And I can remember my first week on the job, we had a huge snowstorm and I didn't have any vacation days. I couldn't stay home. The childcare centers were closed, and I remember calling my friends and begging someone, to watch my child so I could commute to work. And those days, I think for most of us who have desk jobs, quote unquote, I think it's great that those days are over. I think that the culture has evolved so much, and in a very positive way, that women, again, with a sort of white collar desk job, that those of us who were forced to go into the office don't have to. And I think that is going to make it possible for so many more women to continue working, although it's still very stressful at home. We can't pretend that it's all fun and games when you're home homeschooling. It's not, but at least you have that flexibility. But for all those women who are not going to have that choice, remember there are still a lot of women in the service industry, whether they're in healthcare or another service sector, who don't have the choice of being able to stay home. And that's a very large group of people who we have to think about, and they may never have that choice because those jobs cannot be performed virtually. So you know, some of the things I think are very encouraging that I see are some of these public-private arrangements that are happening where, for example, we saw recently there was a announcement about Lyft providing transportation to women who need help getting their children to school or, you know, daycare or any other, you know, wherever they need to take their children. And they're funded by CVS Health in a special pilot program. I thought that was great. But the other thing I think is really important is the community school partnerships where daycare can be provided at the school. And again, we're very lucky in our town. The YMCA has stepped up and provides before and after school care. So for women who can't possibly work home, there's an option for them. They can drop the child off before school, and they have a safe haven for those children after school. So to answer your question, Jane, I think, you know, for this to all work in the future, remember that not everyone will work home. And so we do need to have these childcare options. It really, I think, is extremely important that we have better childcare options. One more thought on work at home is that it's a double-edged sword, I think, because one day COVID will be over, I pray. You know, we all pray the crisis will be over. And some people may want to go back to work because there is something to be said for a team, people to, you know, especially if you're in a creative industry. I used to feel as if I could get an idea maybe 3/4 of the way, but I needed a team to meet with to get me that extra quarter to get a full idea. So I don't think pure work at home forever is the answer either. But again, I think it's going to evolve. And you know, what worries me is that some companies are going to give up their real estate, right? Because it doesn't make sense for them to have offices now when so many people are working home. But the day may come that people may want to have a place to congregate, and what will that look like? I'm not sure. So I don't think we've seen the end of this discussion at all. But again, I do want to say that I think all the changes so far have been positive. To think 30 years ago what we had versus what we have today, for a working mom, it's just been, there's no comparison.
Yeah, no, I agree too, but I have to agree on the benefit of being in an office, and I think about you know where my industry has a big push towards diversity right now, and there's a certain amount of mentoring that needs to go on, and I don't think really anything can replace kind of in-person mentoring, and you know we have enough trouble with you know people of you know anybody misinterpreting or just the communicating between text messaging or email, and it is so much more important to be in person sometimes. So I'm really glad you mentioned that.
Hey, Jane, this is Nalini.
Yes.
I wanted to interrupt very briefly. We have somebody in the audience, a public health expert, Dr. Sonja Rasmussen, who can give us a very good perspective on the medical aspect. And I thought it was such a rich discussion that to round that off, I wanted to see if we could invite Dr. Sonja to say a few words and add her perspective to this.
Sure, we'd love to have her. Hi, Doctor.
Dr. Sonja, would you?
Sonja. Hi, nice to meet you all. I'm really excited to hear all this discussion, and you know, I listened to Lisa and thinking about what a hard decision this is for parents of whether your child goes back to school or not, and you think there's risks on both sides. There's risks to the social aspects and the educational aspects for your child. I think one thing that's really important to remember is if your child doesn't have underlying illnesses, your child's chance of getting severely ill are really small. I mean, those risks are very small. And so I think we need to keep that in perspective. Now, could your child bring that home, bring COVID home and get you and your family sick? And especially if you're a multi-generational household where grandparents are living there, that is more of concern. I think I was also really pleased, Lisa, to hear that you have to consider what's going on in your area. I think it's a very different perspective if you're in places where the rates are going up, and it's it's just a different situation, a different epidemiologic situation in Florida versus New Jersey, New York right now. So the other thing is I think we all have to support other parents of whatever decision they make. And I'm going to try to convince you all to stop feeling guilty, because, you know, there's no guilt here. We just need to give ourselves some grace. We're all doing the very best we can. We can't this is not the time to try to be Superwoman. You know, we all feel like we have to be everything to everybody, and we've all gone through, and I think it's actually sometimes good. Sometimes I write down my thought process. Why did I make that decision when I made it? Because you know what you know now. Of course, everything, hindsight's always 20/20, but I think based on what you know, people can make a decision on either side and should be supported of that decision. Just one other thing I wanted to say is I'm thrilled with this idea of being able to have more remote options for mothers, because so my daughter just graduated from medical school. That's my little bit of brag. And one of my friends, I posted on Facebook, and one of my friends I worked at CDC for 20 years, and she said, "Oh, I haven't seen your daughter since she was sleeping under your desk when she was sick." I mean, was that sick or what? I brought my kids to work and they slept under my desk while I worked. I mean, really, did I really think I was that necessary to my job? But that's what I thought, So I think the idea that she could sleep in her own bed and I could be sitting answering my emails and writing my papers now, that it wouldn't be seen as a negative to be the mom that's at home with your sick kid versus, and this was at CDC, which I think is a fairly progressive place. So I think this is, as I've heard people say, this is really such an advantage that we're not having our kids sleep under our desks when they're sick. So
yeah. I think that's such an interesting point, Dr. Sonja. Like I was thinking about all the discussions that are going around parents who send their kids sick to school. Listen, 100%. You got a fever, you're fine. Just go, right? Like, I mean, how many of us have said that, right? And I think, having this flexibility of saying, okay, you know what? This is really not the right thing to do for our community right now. Probably isn't the right thing to do ever, but as a mom, you to your point, in your head thinking, I got to be in the office. Like, this is really important to my career. Like, I need to show up. I need to be there. And to have that option to be remote and be as close to in person as possible is really important. And I think, what's interesting is, somebody, I saw this on the question over here. Somebody was asking, Julie, I think, was asking about, if we thought a lot of the women would choose the flexibility remotely, but the men wouldn't. And then, and that would maybe be a negative thing overall for women. I think it's so important for women, especially if they're in leadership or management positions, to set the expectation that every meeting from now on is a Teams meeting or a Zoom meeting or fill in the blank, however it is that we're communicating right now, so that you're not excluding any person who needs that flexibility, going forward. And I think it's also really important to encourage people to take advantage of the flexibility if they need it, right? And I listen, I see a lot of great dads here too, who have the same, predicament. My husband is a saint, same predicament. Unfortunately, his job is not nearly as flexible in this respect as what, my company is doing right now for working moms. And so I just think, I think there's that possibility, but I'm optimistic that, we as women and, we as leaders can continue to push this idea of being inclusive, with the flexibility going forward. Maybe I'm too much of an optimist, but I'm pretty optimistic.
Yeah,
I love what you said.
I'm hoping that this is going to be the way that we're all going to move for meetings.
Absolutely.
And Dr. Rasmussen, I was so glad you brought that up about guilt, because it's also, and I was going to get to, I'm glad you introduced Julie's question, because I found it so interesting. I actually did do a working mom column for Women's Day for about a year, 20 years, or 18 years ago. And one of the things was just, it was kind of teasing my husband, but, how can, sometimes, how can men be so smart and then, at least feign ignorance about what was going on at home? So I had added to my guilt that I had to be the one to be at home. And yes, the only reason I didn't, I didn't go in, often if my daughter was sick, because I could do the exact same job at home, and I consider coming. So, but my husband, he didn't volunteer it. He had the same job at the same company for the same salary, as I like to say, but somehow his was more important. I want any parent to know, or any of the parents of younger people to know, that I've asked my 20-year-old often, and I brag about her too. She's doing fabulous in her public health major at Syracuse. And she says she thinks she benefited from having all these different babysitters. She loved them, and they were cool. She did lots of interesting things. So these kids will become, in many respects, if not most, I hope, more resilient because of these kinds of scenarios. I'm of the belief, I don't know, like Gloria or Tammy, I mean, I would rather, I'd be one of those parents that would be leaning towards sending my child, because I just think there's too much to be gained from the interaction. You learn so much from just dealing with the ins and outs of dealing with school, the interpersonal reactions and what a teacher wants. Gloria, which way do you think you'd go if you were parenting now?
Yeah, I probably would. I probably would lean towards sending the child if I could be assured that all the right safeguards were in place in the school. And again, looking at our community and what our rate, of infection was in our community. I did have to wince though a second ago when Lisa talked about sending a child in with a fever. I was very
It was low fever, very low.
Or my daughter,
not a fever.
my daughter would say, I have a scratchy throat. And I'd say, well, just go to school. I mean, they can call me if I have to come and get you, which, you feel like the worst mom on earth for doing that. But when you're forced to go in the office, that happens. And thankfully, many of us don't have to make that choice anymore.
Right. Another, we've kind of touched on this, but this is such an important topic. I'm happy to talk more about kind of the divide. Is this going to create more of a divide between the kind of the haves and the have-nots and the people that can't stay home? Because I mean, it's doctors too. It's not just like people that work at Burger King. But maybe there's more we could all be doing to help each other. That would certainly be one solution. Tammy, is that one of your concerns, or maybe is there enough of a confluence of events with concerns about racial disparities and that maybe things could start going in the right direction in COVID?
So yes, I mean, for Black Women's Health Imperative, I mean, one of the things that we early on did was to, we created like similar to what we're doing here, but created a virtual webinar series where we heard from women across the country, and we focused on we did like a national webinar, but then we also focused on different states, like what's happening in North Carolina, but then what's happening in California, what's happening in Florida. And we partnered with the Coalition of 100 Black Women to do that. And what we're looking at doing in the next month, 2 months, is releasing a pandemic guide for Black women. But what we saw early on is that a lot of the concerns really, again, each family has to do their own assessment. But because, for example, you look in, and even for me, I know at one point in DC, and if you look at like the rates of African Americans that are actually dying from COVID, it was like 60, it was a high number, like 60 or 70%. And so if you're debating whether you should send your child to school, I mean, you really have to, look, if you just happen to get it, for families that have people in their families with underlying conditions, just cardiovascular and obesity, and also diabetes, which is one of the Dr. Sonja can probably speak to this, but that's one of the, those are some of the top underlying conditions that are impacted, and minorities are also disproportionately impacted. But some of the mortality rates from COVID come from those underlying conditions, and so we wanted to really hear firsthand some of their experiences. But yes, we do think that it will. It's shining, as Dr. Fauci said, it's shining a brighter light on the disparities that were already here. And so what we're trying to do now is, and even after COVID, we still need to address these health disparities. But all this still translates, sending your child to school, if your child just happens to test positive, and taking all that into account. But the short answer is definitely yes. I mean, we're also, not to bring the voting piece in, but we're also addressing just empowering people to hold their elected officials accountable, to make sure that we put these different policies in place that could be helpful, again, with the child care piece, even with the unemployment piece. So there are all these other external, besides just, should we send them to school or not? Should we, there are other factors to take, particularly for minority and low-income women, to take into account.
So how does, let's just go around and if everyone could just talk, it's kind of a two-part question. on just how do you feel, to be candid, your mental health? Like, do you feel like this is stressing you out incredibly? I'll just quickly mention that I actually realize I certainly am as stressed as anybody in the media, runs a nonprofit on the side, but I will also say that not having to be so many places is kind of a comforting thing. Like, I can't be too many places because no one will have me. So there's something about that, and I have heard that children that have anxiety and other kids like that are kind of enjoying it. But I just want to quickly say, I make myself a walk for at least an hour a day, and then anxious to get back to some sort of a more of an exercise routine. And I'm trying to read because I read that it helps ward off Alzheimer's, and it just gets my mind. I tend to pick up books that have to do with some of the deeply depressing things that I cover. So that's what I do, but and that's how I'm coping. It gets very stressful, but I have to just walk away from the computer. Lisa?
Yeah, yes, it's definitely stressful, super overwhelming at times. And there was definitely an adjustment period to get everybody, going in this new normal. I'd say for me, it became early on, it became very clear to me that I was not eating the way that I should be eating. I was not exercising the way that I should be exercising. And that was just making things 10 times worse. And so that's something that I've recently been trying to focus back on. And now that the gyms are actually open in Massachusetts, you have to wear a mask. It is miserable to work out in a mask, but it's way better than not getting any exercise in. So I choose to get up early in the morning before my kids get up and go to the gym. And that's my me time. And it's my de-stress time. And so that to me was super critical. And then another thing I found during COVID time was I have this newfound love for puzzles, which I didn't discover until COVID. And so I would set up a huge puzzle in the dining room, and I would just, in between meetings, if I ran up to go to the bathroom, get a cup of coffee, I would try to put a puzzle piece in. And it was like this release for me. And it was also cool that the kids could come by whenever they wanted, and they would try to put in a couple pieces. And then at night when we were all together, we'd work on it, some nights together. So that was another good de-stressor for me that I didn't anticipate. But definitely the eating right and the physical activity, I totally underestimated the value of, those activities. And, that for me, that's key, going forward.
Tammy, wait, we're running out of time, so we have 3 minutes. Go ahead, Tammy.
Let me be quick. Yeah, so I agree with Lisa again. I mean, it's just definitely for me, definitely it's been, for most Americans, it's definitely been, a tough period of time. But I think, yes, being very intentional about what those breaks are. I mean, for example, I, been, in the house for 4 or 5 months, and, last week decided to take a week away and go to the, drive to the beach if you don't necessarily want to fly. So I think, yes, being very intentional, walking every day, and then taking even some of those hard breaks and just having a change of scenery. So yes, it's been tough, but I think it's being intentional about your mental health and taking breaks.
Gloria?
I would underscore what everyone's already said. For me, I'm doing much better than I was in the beginning, but I like to have a routine. So I've created a new routine for myself. I just feel better about having, I put myself on a schedule, even though I have no real schedule. But the other thing I did is I started stepping away from watching the news so incessantly. In the beginning, I had the news on, 24/7, and it was becoming an unhealthy obsession. So I don't allow myself to watch any television at all until the evening, and then I'll watch the news and I'll get aggravated, but at least I've already done, all this other great productive stuff during the day. So for me, that's been very helpful. The one thing I miss so much is travel. I used to love to flit around. And of course, that's other than driving trips, as Tammy was saying, I just had to kind of say, okay, you're probably not going to fly for a little while, but it's not the end of the world. But yeah, back to, it's really almost like one day at a time. I just, do you have sort of, some days are lousier than others, some days feel okay. And that's sort of the way I take it.
Nalini, you're wrapping up, but what are you doing to chill and how are you feeling lately?
Yeah, so Jane, I let my my family pitch in. I don't have to produce 21 meals in the week myself. I have my husband makes coffee, my daughter makes dinner, and the other daughter makes lunch. So this is working out very well. I'm actually working less than I used to.
Oh, good.
It was all great. But thank you very much, all of you. This has been a fascinating discussion. Thank you for unpacking this issue. You know, how do women cope? You're all super women. Thank you very much for your perspectives on how to balance this and to see the sort of the light and to see it, to end it on an optimistic note. Thank you very much. I just wanted to wrap up and say, hey, our next webinar is a cooking webinar where restaurant chef from August 1-5 will demonstrate a healthy recipe. It's an Indian restaurant, very popular in San Francisco, and they will speak to us on September 25th at 11:30 a.m. Pacific time, okay, 2:30 p.m. our time, East Coast time. And then one last plug for our fundraiser, an online fundraiser, national gala on December 5th. Please join us. This is Arogya World's National Gala. This is our 10th anniversary, so please join us. Thank you very, very much. We'll send the recording to everybody who registered. Thank you.
Thank
Thank
you.
you.
Bye-bye.
Bye-bye. Thank you, everybody.